I'm Apshi Vimal and this is Health Matters by Malaysia Healthcare. Today I'm here with Dr. Syahirah and Kim Raymond to speak all about fertility. Okay, so thank you both for being here today. I'm actually really excited to talk about this topic because I don't really know much about fertility. I think we never really talk about it when it comes to day-to-day life and conversations, but I think we're often always told that oh, you need to have children, it's a big part of life and all of that, and you don't really think that, can I actually have children? And if I am struggling to do so, what do I need to do to make that happen? So my first question for Dr. Syahirah is, how do we define infertility?
Okay, so for couples who already getting married, meaning that they have been trying having unprotected sexual intercourse. So basically, after 2 years of trying, and if they fail to conceive, I can tell that this is actually subfertile. You see?
Subfertile.
Subfertile. But those for less than 35, yes, we can wait up to 2 years. But for older age women, example like those already more than 35, so usually up to 6 months only is good enough for us to define as infertility, subfertility.
And after 2 years?
After 6 months,
after
for
6
older age
months.
women, yes.
Okay.
For younger, yes. Less than 35 can wait up to 2 years.
So how would I know if I'm infertile? Are there any symptoms? Is there anything that I could be oh, hey, maybe that means that I might struggle to conceive?
All right. So basically, if you have been trying, you see, and then if you fail to conceive, and the fact is you have been having regular menses, you see, you should come forward, you see, because by right, if everything is fine, how come you cannot get pregnant? So in this situation, definitely you need to come forward for assessment. Then only you will know what's other problem that you are not aware of. You see?
Yeah, and so if just say I'm not trying, but I'm just curious, there's no way to know, there's no way my body will tell me in other ways apart from trying to conceive. Yeah.
So basically, but if you have irregular menses, that probably related to subfertility as well, because those having irregular menses, they tend to be an ovulatory cycle, meaning that most of the time they are not ovulating. You see? Yep. So if you are having irregular menses and then probably you have very severe pain every time you have menses, you probably have gynae problem as well. So then you should think whether that could be the reasons of being subfertile.
I think that affects a lot of women, right?
Yes.
The periods just all over the place. True. And then it's very pain, and you just don't really necessarily think that, hey, maybe that means I might struggle to conceive.
Yeah.
So is there anything we can actually do to stop it, on our own?
So basically, certain things if you want to boost up your fertility, you see, try to be as fit and healthy as possible, you see. So, because studies has proven that those overweight, obese women, they tend to have hormonal imbalance, you see, irregular menses, and that will affect their potential to have ovulations as well, you see.
Okay.
So, that is one of the ways that can be done. But things like age is something that you can't change, you see. Older age women also tend to have subfertilities.
Okay.
Yep.
So, Kim, I wanted to ask you, so what has your journey sort of been with fertility, and now you have your beautiful daughter and that whole journey? What was that like for you?
Well, okay, firstly, I have PCOS. It's called polycystic ovary syndrome. So like doctor was saying, irregular periods, and I don't ovulate. So that was the biggest struggle for me. And on top of that, I also had a uterine septum, which I didn't know at the time. I only knew when I was doing my C-section. So yeah.
You only knew it all the way then.
Yeah, that's why I gave birth premature as well, because the baby was growing on one side.
Okay.
Yeah, so but yeah, I mean, I was trying with my husband at the time then for 2 years, and nothing was happening. So I went to see a fertility doctor, and he did tell me there were other ways, maybe you can try taking supplements first and whatnot. But I was like, you know what, I'm already of this age, and I would like to just go ahead and do IVF.
Yeah.
So, I mean, I was very lucky because on my first try, I actually got pregnant.
Amazing.
Yeah, so, and then now I have
Now you
Syahirah.
have Syahirah. And did you know you had PCOS prior to trying to conceive a child?
Yeah, I did. I did
You
know. I did know, but I never knew how severe it was, or like, you know, how serious it was, because at the time, I don't think there was much talk about PCOS yet.
Yeah.
I mean, as opposed to now, right?
Yeah, now on TikTok, they're
Yeah,
like PCOS
like
diet.
a lot of awareness on
Yes,
PCOS.
yes.
Yeah,
Yeah.
you know. So, but I mean, I when it came to symptoms, I wasn't really aware either, you know. I was just like, oh, I have PCOS, so just go about my life. But yeah, when I wanted to do IVF, also I had to take some medication for it, you know, to regulate my periods and stuff like that.
Yeah, I'm sure it wasn't easy, the whole
Yeah.
process. So, Dr. Syahirah, could you tell us what IVF is?
Okay, so IVF is actually, in full name, it's called in vitro fertilization, meaning that we are making babies in the lab, you see.
Okay.
So definitely it's a challenging process because women need to go through multiple injections of drug, you see. Usually after around 2 weeks, we need to do a procedure called egg pickup, where we're going to retrieve out the eggs, and then this egg will be fertilized with the husband's sperm, you see, and to produce embryo. And then we're going to grow this embryo in the lab up to 5 days.
Oh,
Right?
wow.
And then we will transfer this embryo as fresh, or we probably might freeze this embryo and transfer the embryo later.
So when you freeze it, how long can you freeze it for?
As long as patients wish. But it's
wow.
just that the longer you freeze, definitely more cost for you to pay.
Oh, more expensive.
Freezing charges, yes,
Okay,
yes.
okay. And so is it a very tough procedure on the person? I mean, you've been through it, Kim. Was it tough?
I think it depends on, I mean,
On
because
everybody-
you know, when you
everybody,
do
yeah.
IVF, you are really looking forward to having a baby, right? So I don't think people think about it in that way. Well, not me at least, you know. It was tough, you know, injections and all. But I was really looking forward.
You were just
you
like,
know,
I want to
so
make this happen.
I was very focused.
Yeah.
Yeah.
Yeah. So what's the rate of success with IVF?
So basically, at our center, for frozen embryo transfer, we have higher success rate. It can be up to 60 to 70%.
Oh, wow.
Because in frozen embryo transfer, you have more stable hormones, you see, because we prepare the patients, you see. As in fresh IVF cycle, there will be many follicles, you know, and after we do egg pickup, there will be a bit of hormonal imbalance sometimes, and that's the reason the rate is slightly lower. You see, it can be, but it's still quite high, around 50%.
But I can imagine it would be quite tough if you went through the procedure and then
Definitely.
it didn't
Yep.
take.
True.
So what about IUI? What is that?
Okay, IUI, it's called intrauterine insemination, where it's actually in terms of success rate is almost similar if you were to have intercourse, because IUI, the process of fertilization is like a natural process. You see, because the
Okay.
sperm need to meet the egg and fertilize naturally.
Yeah.
You see, it's just that the difference is intercourse is, natural.
Yeah.
All right. IUI meaning that doctor will prepare the sperm outside, and then we're going to transfer it into the uterus through the vagina. So that's the only difference. But definitely those who go through IUI, we need to give medication as well, either oral medication or injection. And then at the time where the follicle grow at the up to matured size, then only we're going to proceed with IUI.
Oh, okay. Was this something you considered as well?
No, I just decided to do
You
IVF.
straight IVF.
Okay.
So, but how would people make that decision if they wanted to? Like, if I wanted to do it, how would I decide which is right for me?
So basically what I used to do is I'm going to have a discussion with the couples, you see. It's not a matter of it's a matter of few factors that we have to consider, like patient age, patient's problem, you see, financial status as well. Because IVF is definitely much more expensive if you were to compare with IUI, all right? So, but those older age group, you see, maybe issues with ovarian reserve, egg reserve already low, you see, and probably having endometriosis, you see. So this group of patients, usually I will counsel more towards IVF. Or in the setting where they have tubal blockage or severe male problems, you see, definitely need to go for IVF. But in younger age group, those may be less than 35, they have no issues with egg reserve, they have adequate egg reserve and normal sperm qualities, you see. So this group of patients provided pattern tube as well, both minimum one tube must be pattern. So in this group of patients, yes, they can try IUI.
But I guess like, I'm just curious because you said it's so similar to like natural conception through intercourse, right? Why would someone decide to do IUI? Like, you know what, how would you make that decision? Because it sounds like it's just like making it at home.
Yep.
But maybe a bit more.
Yeah. But I think IUI is probably, in a way, it shortened the distance
Okay.
of sperm
It doesn't
traveling.
have to swim so far.
Yes, like
So it doesn't have to find its way.
yeah, like we are trying to shorten, like making a highway, you know, so that faster for the sperm to reach the eggs. So that kind of thing.
I
But in terms of
understand.
the success rate is about similar.
Similar, okay.
Yes.
And how much do these procedures cost?
You mean for
IVF and IUI.
All right. So it depends. For IVF, it depends if you go for a frozen cycle with biopsy, you see, or if you just go for a fresh cycle, definitely there will be a bit of difference. So frozen cycle probably is much more expensive. It can be up to 30 to 40,000.
Oh wow.
You see.
Yeah.
But for fresh cycle, it can be slightly cheaper. All right. For IUI, roughly around 2,000 to 3,000.
Okay, that's much more affordable.
Yes.
Yeah. So I think when we talk about fertility, right, we often talk about women and like our ability to, you know, carry the child and all of that. But what about on the flip side? What about men? How does infertility affect men?
So basically, studies has proven that about 1/4 of the cause of infertility, it can be combination of both men and women.
Being incompatible.
Yes, 1/4 due to men cause as well. So it does affect fertility treatment, you see. And so that's the reason both men and women need to come forward together for assessment.
Yeah, because I feel like
Yes.
so often it's always talked about women. There's also the
Women,
part of it
yeah.
where, I mean, it takes two to make a baby, right?
True, definitely.
Yeah. For you, Kim, like how was it for you, like, you know, in discovering that it wasn't so easy to conceive and all of that? Like how was that journey for you? Like, you know, like medical decisions aside, like how did you feel going through it?
I think I wasn't upset or anything. I was very like I said earlier, I was very focused and driven. I was like, I want to have a baby, I'm ready.
Yeah.
So whatever it takes, you know,
Yeah.
I didn't feel less because I you know, I was infertile due to PCOS or anything. For me, I've never had, you know, those feelings. So yeah, it was just, you know, going through with it.
Yeah.
You know, mentally being ready.
Yeah, I think that's amazing though that you didn't like kind of let it like bog you down. You're just like, you know what, I'm gonna make it happen. Yeah. I guess that also plays a big role. Is also how the patient feels, right? Because I'm sure that people can be very sad and disappointed and struggle a lot with it. So, jumping back to men, what are treatments that men can do to increase their fertility?
Okay, so depends on what is their problems like. So most of the time it's just a bit of reduction of the sperm qualities, which actually mostly manageable with lifestyle modification. Example, like if they have been smoking, maybe they have to stop smoking, stop taking vapes, you see, and weight optimization as well, because even obesity among men also has been related to reduction in sperm qualities, you see. Of course, diet, you see, healthy diet plus supplements, you see. So we have supplements which can help to boost up sperm qualities. All right. So these are group of cases that can easily be managed, but definitely there are cases like those who have no sperm at all. You see, meaning that they have semen, yes, but it's actually empty without sperm. you see. So this kind of cases, definitely we need to assess, we need to investigate what's the reason for it, you see.
Yeah.
Usually it probably because of obstructive cause, you see, meaning that there's a blockage following they have been produced and being stored inside the, the structure, you see, but they cannot travel out, you see, due to blockage. You see, so but this kind of case can be managed as well. We can do minor surgery to retrieve out the sperm.
Oh, you can do
yes,
surgery.
we can do.
Okay, so it is both invasive.
It's not really invasive because it's just a small incision.
Okay.
I'm sure men won't think it's just a small
It's just a small incision. Yes.
So what are some of the outside factors that can contribute to infertility? Like you were saying, lifestyle is also part of it?
Potentially affect, like you see, as I mentioned earlier, other factors that can affect, you mean for men fertility?
Both men and women.
So probably something that we are not aware of, we don't know, you see, because there are cases where we have investigated both men and women, everything's fine, everything is normal, you see. We call it unexplained. We have such cases as well. So unexplained, it can be anything. Something that we can't see with our naked eye. What's the exact cause? Yeah.
Is that just genetics then?
Possible. Genetics,
but still
chromosomes.
we can't draw a conclusion.
Yeah, that makes our egg quality very low, very poor for women, or even sperm quality very low due to chromosome issue maybe. It's something that we can't see and it's not easily diagnosed. Yes.
So what can yearly health scans tell us about our fertility?
So basically, if we were to go for yearly health screenings, example like for women, we can do scan probably.
Like a scan
just
for
a gynae
ovaries?
scan, to check our ovary, to check the ovarian reserve. You see, we can see follicles inside. And then probably we can do a blood test. We call it AMH. So it's also good in terms of reflecting egg reserve for women. You see, so it will give us an idea in terms of probably like, let's say we have like a very low reserve. So maybe we can pre-inform to these patients that you cannot wait too long. If you have partner, maybe better to get married and have children. You see, so I think that's gonna help very much.
Is there a point where conception is just you can see that it's probably never gonna happen?
Okay, if you go for your own eggs, you see, that like I just saw few patients, one of the patients recently, she's quite young, you see, so which turned into ovarian failure, all right? So certain women is probably just unlucky, they turn into ovarian failure, they turn into menopause earlier than the expected age. So in this kind of women, definitely it's impossible for them probably to get pregnant using their own eggs.
Okay.
Yep.
That's when you know, like, it's
Yep.
probably not going to happen.
Yeah.
So I also wanted to ask, because we were speaking about PCOS, Kim, how did you find out you had PCOS?
It started with irregular periods, and I've always had very bad cramps. So I went to the gynae and I got checked, and then she told me that I have PCOS.
How do you check for that?
It was so long ago.
How old were you when you found out?
I was in my 20s actually. I think maybe like mid to late 20s. Yeah.
Okay, so what actually is PCOS?
Okay, PCOS stands for polycystic ovarian syndrome. So basically, it's a condition where women tend to have irregular menses. They're probably not having any menses, sometimes up to 6 months. And they tend to have, due to presence of more male hormones, they tend to be probably the symptoms like more towards female hair distributions, like probably having hair at the inappropriate area. And
like
then
facial hair,
probably
like,
facial hair, you see. And then if we were to examine them, they probably have ultrasound features of PCOS, and definitely confirmatory by blood tests as well. We're going to do hormone level, where most of the time they are not ovulating.
Okay.
Yep.
Yeah. And do you how would I know if I'm not ovulating? Would I be able to know just on my own? Were you able to know, Kim? Did you have any idea?
No, I didn't know. I think it was only through a scan that
you were able to really get your answer.
But generally, if you have a regular menses, like example, like 28-day cycle, so roughly mid-cycle maybe around day 10, day 12 to day 16, that would be we call it as a fertile period, you see. But in order for us to know exactly that we ovulate, when exactly, then we probably need
like an ovulation test.
Yeah, ovulation test probably, which might be helpful. Or like other features, like probably if you have more discharges, that probably will suggest. Type of discharge is also slightly different. It's more clear and looks like egg white discharge.
Okay.
Yeah, white egg, sorry. Yeah, discharges. Yeah.
Okay, and some of the ovulation symptoms are also very similar to premenstrual symptoms as well,
certain
right?
people have like maybe headaches, nausea, and probably have breast pain. You see, like menstrual cramps.
Yeah.
Which can happen.
Yeah, that's me.
Oh, okay.
What about endometriosis? What is that? Because I always feel that PCOS and endometriosis, people kind of get them confused. What's the difference?
Okay, so endometriosis is really different from PCOS.
I'm like, I thought it's the same thing.
It's not. Endometriosis is a disease affecting reproductive age women usually. It's due to estrogen, related to women's hormone, estrogen hormones. So that's the reason it affects those who still menstruating, so who still have menses, you see. And what happened is that there is retrograde menses. The blood goes backwards, you see. Some of the blood goes backwards. So it causes irritation, inflammation, you see. And that's the reason women who have endometriosis, they tend to have period pain even before having menses.
Yeah.
Yep.
Can that cause like infections like in your body, like in your uterus and all, because the blood is flowing
backward? It doesn't cause infection, you see, but it causes irritation, pain, a chronic pain, you see, and definitely it will affect your tubes, your ovaries. So that's the reason they probably tend to have tubal issues like tubal blockage, and they probably have ovarian cysts as well.
Okay. So what are some supplements that maybe you've also taken and that you would recommend to take for while you're pregnant or if you're trying to conceive?
Okay, so basically for any woman who plan to conceive, important supplement like folic acid definitely for baby formations, all right. Other supplements which potentially beneficial for TTC like CoQ10, vitamin D. CoQ10 is good for egg quality, especially in those preparing for IVF, and vitamin D as well, which can improve implantations for embryo implantations.
Did you take all of those supplements?
Yeah, I'm pretty sure I did. But I also was told to take a glucofudge for my PCOS.
Oh, okay.
Yeah.
I think that's sugar.
Yeah, it's for people who have
it's a diabetic drug.
Yes, correct.
Anyway, but it helps to regulate the menses.
Oh, I didn't know
for patient
that.
with PCOS, yes.
Yeah.
That's so interesting. So who is a good candidate for IVF? Like, how did you know that it was the right choice for you, Kim?
So basically, before you do it, you have to go through some tests. Not just the woman, but also the man, right? And they will, I guess, check the quality of your eggs and then the sperm and whatnot. And then the doctor will give you supplements if you need it. But I don't think there are people that can't do it, right?
As long as they still have eggs, the husbands also have sperms. We can do it.
Yeah.
We just need some eggs and some sperm and make it happen. Okay, nice. I think another thing that, once you get pregnant and, you're excited to have the baby, there's always the risk of miscarriage. Is that something your doctor spoke to you when you were...
Yeah, definitely. I think that's something that you have to be prepared for, because, I mean, when it comes to getting pregnant, it's never a sure thing.
Yeah.
And I mean, I guess my size also was a factor, because I was much skinnier than I am now. And so the doctor did obviously, tell me about all these things, because I think like I did an extra testing after, so I froze my eggs, and then they tested all the cells and to make sure that it was a healthy embryo. Yeah.
That's good. Is there any way that we can prevent miscarriage?
So basically, if we were to try natural conceptions, things like if you have any medical illness, make sure it's optimized before you plan for pregnancy. Example, like if you are diabetic, so make sure your sugar is well controlled, because I think uncontrolled diabetes has been associated with higher risk of miscarriages. You see, as well as weight reductions, weight optimizations. If you are obese, also you are at higher risk of miscarriages. But if you go for IVF, we have the technology as what have been mentioned just now. Like you did a biopsy as well, right? So like those with risk, those older age women, you see, or maybe have recurrent IVF failures, usually we strongly encourage them to go for IVF with biopsy, meaning that we're going to take a bit of tissue from the good embryo to analyze the chromosomes. So then we're going to transfer a normal chromosome embryo, hoping by doing that we shorten the time to pregnancy.
Okay, and that will, to a certain degree, reduce the
because
chance
most common causes of miscarriage is actually related to chromosomal abnormalities.
And one of my last questions is what are the side effects of IVF?
Alright, so side effect of IVF, of course, since patients have to receive multiple injections, you see, they're gonna have like all this bloatedness, you see, abdominal pain, distensions, which in medical term we call it OHSS. Alright, so especially those who have PCOS, they are at much higher risk of OHSS because they have many follicles. You see, like if you have patients, older age patients where they don't have that many eggs, they will not have these problems. You see. Other complication, of course, when we transfer more than one embryo, they're at higher risk of having multiple pregnancy, twins, sometimes up to triplets.
Thing, right?
Even sometimes we transfer one also, it can split into two. You see?
Identical twins.
Yes, identical
Oh my
twins.
gosh.
So they can have multiple pregnancy. And of course, if they have multiple pregnancy, they are at higher risk of having preterm birth, having a low birth weight baby.
Yeah.
All right.
What were some of the side effects you faced?
I think maybe some hormonal side effects.
Did you feel very moody?
Kind of like up and down, but I don't think mine was very bad because I don't remember anything negative. So.
That it was like so bad that it's like stuck in your
obviously
head.
I had to inject myself.
Yeah.
So that was at first a bit nerve-wracking, but after I got used to it, then it was fine.
Then it was okay.
I was just excited.
Yeah. I guess that's good that you like had that attitude. It will also play a part in why it was successful.
Yeah.
And I actually do have a question about freezing your eggs. So when should they decide to freeze their eggs? What is the best age to do it, and what is the process like? Is it similar to an IVF process?
Egg freezing.
Yeah.
All right. So usually, egg freezing we will do for medical indications. Example like, especially if I have if I get a referral from cancer department, you see, if they have patients like young patients, you see, they are not yet married, they are still single, right? So before, let's say they're being diagnosed for breast cancer. So before they have to go through chemotherapy, because this chemotherapy potentially gonadotoxic, meaning that it can cause destructions to ovarian tissue, which in the end it can kill off these follicles, these eggs.
Like permanently or?
Permanently, it can cause reductions. So it will affect patients' fertility potential later. Right, when they get married later. So what they can do is that they can get referrals to fertility specialists. So we can stimulate them like going for IVF, and then we're going to freeze these eggs. After that, they can continue with cancer treatment.
What is the best age to freeze your eggs if you were going to?
The younger age you are, the better, definitely, because egg quality is better. And of course, you need to have a normal or good ovarian reserve. That will be better as compared to if you already have very poor ovarian reserve, you see. or probably you already advanced age, might as well, if you have a partner, then it's much easier. You can just go for IVF. But in case you are still single, yes, you can. But of course, the chances of you having a good quality, good number of eggs to be frozen probably lesser. Yeah. The younger, the better.
Because you hear now of a lot of people, like, they freeze their eggs, like, you know, while they're young, and they're like, okay, I'm just gonna, like, keep this as insurance, and then, like, as I get on with, like, you know, want to really work on your career or whatever, and then go back to it when they're ready to have children. So I think that's interesting to know that, like, if you think about doing it, you should do it when you're young, lah.
Yeah, definitely.
All right. Well, thank you both so much. It was so interesting. I really feel like I learned a lot. And thank you so much for sharing, Kim.
Thank
It's a
you.
very
Thank
personal
you.
thing. And thank you so much, Doctor, for all the information. I feel like I really, really learned something today. And thank you all so much for watching. This has been Health Matters by Malaysia Healthcare.